All right, so first, kind of what is case management redesign? How did we get here? What am I going to be talking about? And so in 2014, there was an executive order and recommendations put out by the Community Living Advisory Group to redesign case management. To better support members to have quality case management services and quality services in their homes and communities, where they could go to one place for all waivers in their area. Additionally, the federal government enacted a rule that is often referred to as a final rule, or you may have heard it as final settings rule. In addition to the sweeping changes required states to ensure community-based settings were truly integrated into the community and brought to a higher standard. To many residential settings, it also required that case management agencies could not provide services to the same person they were responsible for providing case management services to. So Colorado and every other state had to come into compliance with this federal rule in order to continue to operate those waiver programs and maintain funding to do so. So Colorado embarked in a journey to create a new assessment that better reflected those needs and supports of the individuals in our waivers, and create a person-centered support planning process that directly relates related needs to services being accessed. And all of these efforts and federal changes, new ways of thinking and innovative practice resulted in what we call our case management redesign. So our current system separates the intellectual and developmental disability, IDD, from other disabilities due to history. So historically, Colorado's disability services have been underfunded, which leads to people not having these services. So they need services they need or not high enough quality. Feedback from stakeholders in Colorado is that our home and community-based system is complicated and folks don't know where to go or how to find what they need. When they have to switch waivers, they have to switch agencies sometimes. Each agency is not informed about what the other agencies are doing. And therefore there's not as much knowledge about the waivers that they didn't provide. So we've also had a shortage of providers, especially in rural communities, and single entry points and community center board systems don't align in the types of case management, the quality, the payment structure, etc. But that is what we are hoping to change and improve. So in Colorado, the current state is Colorado operates 10 home and community-based service waivers. Each one requires that members meet the eligibility requirements, whether it's their diagnosis, age, injury, etc. As you can see from the chart, Colorado has 6 adult waivers and 4 children's waivers, each with its own set of criteria, required that an individual meet before assessing those services. Each waiver requires that members are connected with case management agencies and are assigned a case manager who supports them in connecting to their services offered in their respective waivers. And next, I'll explain how these waivers have different case management entities. So as mentioned previously, Colorado administers 10 waivers that are supported by 3 different types of case management agencies, as this chart demonstrates. The case management agency you went to depends on the program you qualify for, making the system confusing and very siloed for people trying to access it. We wanted a system that aligned with our key outcomes for case management redesign. The silos and the structure required the department to make changes, the Department of Healthcare Policy and Financing to make changes. First and foremost, there was a lot of stakeholder engagement. The siloed systems, having different case management agencies for different types of waivers, was causing confusion, and people didn't always know where to go to get the help that they needed. The Colorado stakeholders had agreed that creating a system that reduced confusion, was simpler to navigate, and focused on quality and accountability for case management agencies was the highest priority. They loudly stated that they cared more about the quality and accountability of their case management agencies than they did of anything else. So Colorado's vision for case management agencies was a new system where they no longer separate members based on their disabilities for case management services, but rather discuss the needs of each individual and serve each one as a whole person, and for each individual served to experience case management that embodies simplicity, quality, stability, and accountability in a conflict-free environment. And that is just kind of, that takes us right now to, this is basically what we consider our filter for all of the initiatives that we've undergone with case management redesign so far. If anything is not meeting the federal compliance quality, doesn't show that there's simplicity, that there's a way to create stability and accountability, then a lot of those things were kind of taken back to the drawing board, or we've had to do extra meetings with some of the stakeholders in Colorado, filter through, or having different community advisory committees and agencies and people kind of looking at that and trying to help us also create and make some of those decisions to be able to move forward. So this little filtration system that we kind of have here was one of the most important keys for all of our key outcome of case management redesign. So basically, going forward, all case management activities and services will be included in case management agency requirements starting in July of 2024 for all individuals. And I have more to go over with how we're starting that process, what it's looking like now. Lots more items about how we're making this and how we're implementing this, but I still want to be able to pause and see if anybody has a question so far. If so, please, you can come right off of mute and ask. It's no problem.
My question is, how will it affect people already on the DD waiver who live in one county and will be moving to another?
Sure. So I will get into that a little bit more too, of those changes and how they're going to work. But there's the most important takeaway from any of this is it should not affect any services. So it's not going to, it's kind of like if you were moving from one town to the other, if you've ever had to do that and move from one case management agency to the other, the back end, like the part that it shouldn't affect the members as far as any of your services or changes in those services. It won't, sorry, like affect eligibility, things like that.
So my daughter could stay with the same CCB?
And that I can get into in a little bit too, because it depends on who that will be.
Okay. Thanks.
Sure. And I will, I'll go into all of those details too. Okay, so I'll keep moving so we can get there too, and get into all of that. So here is kind of what those changes are going to look like in the future. A single case management agency will serve all people with disabilities within their contracted defined service area. So this is a change, as today we have 44 defined service areas in which 24 single entry points serve and 20 community center boards provide services. We also have 4 private home and community-based service case management agencies that serve statewide. So to implement case management redesign in the service areas, we had to consolidate that. So information was gathered from stakeholders to inform the final decision for what future defined service areas would be. The following were used as kind of key considerations for those demographic areas, and that was the geographic barriers, economy of scale, population density, and the future. To inform this work, the Department of Healthcare Policy and Financing hired a contractor to kind of help navigate this and build this map. So again, what is really important is, yes, we are going from about, I think we have 45 or so current, because it's changed a little bit even from probably when we did this last. We have about 45 case management agencies now that are either SEPs, community center boards, SEPs is single entry point, community center boards, kind of like that other diagram showed, or private case management agencies. We are now, which I'll announce those in just a little bit too, we are now down to 15 case management agencies that will be awarded the new case management agency contracts for Colorado. And again, what is not changing? No, there's no changes with access to services, waiver or eligibility, the person-centered approach, the required case management, and we are really working to keep that local knowledge and expertise within our case management system. Now I will get into the transition process. So defined service area providers were announced. The request for proposal to try and get new case management providers that wanted to take on the contract were released in December of 2022 for all providers for the newly defined service areas. By July 21st, 2023, all 20 areas had a provider who was notified of the home and community, or of the HCPF, or Healthcare Policy and Financing intent to award those case management agencies with their new contracts. There were a total of 15 agencies across 20 defined service areas that were announced, and pending any kind of protest, will move forward. And Gabby, I see you have your hand raised.
I'm sorry, it took a minute before you moved to the next question, the next topic, but I have a couple of questions. First, how are we centralizing? I mean, the point of all of this is to centralize the applications that go into everything, and yet we are going to have not families, but agencies applying to get contracts with the state. So we are still gonna be having those agencies. That part I don't understand. And then basically the other agencies are just gonna go away, disappear.
Yes, so the way that it worked was we kind of put out a request for proposal to see who wanted to bid to be the new case management agencies in Colorado. So basically, community center boards, that terminology, and SEP, or single entry point, those terminologies will no longer exist because everything is going to merge into one. And 15 new case management agencies have been given an intent to award contract. So they were already kind of contracted under the state of Colorado, under the Department of Healthcare Policy and Finance. So now there's going to be the new ones. We are going to be transitioning for any of the ones who did not bid on the contract, or who did not want to, or who didn't win the contract. Those ones will be going out in different ways. So for some of it, part of the reason was because the federal guidelines required that we no longer have, we had to become like in compliance with the conflict free. You'll probably notice like a lot of some of the community center boards, like they also have a big arm with, some have where they do respite care, some do day programs, some do, and they weren't allowed to provide those services and case management, because then it put them in conflict, because then they could just be sending anybody that the case manager should be kind of just guiding you on the resources in Colorado, but not to their own business, if that makes sense. So some of them decided they would rather keep their private kind of duty, the provider business. So it all just kind of depended on those aspects too.
Okay, and that's fine, that's clear. But since we're gonna have contracts awarded to these agencies, then how could it be a centralization of the system?
It's central because now all of those waivers that we mentioned before, where, you know, some of the waivers were under single entry points, and other waivers for like IDD were under community center boards. These case management agencies are going to serve all 10 waivers, no matter what the disability, no matter what waiver you're on. There's no more kind of, you know, for some of the kids who then have to go into the adult and then move to SEP side, just different things that can happen that way. It will all be served under that one case management agency roof in that newly defined service area, if that makes sense.
Okay, thank you.
Yeah. One of the big reasons for that too is, I mean, you know, we have so many agencies right now, so many different guidelines, so many different ways that they do things, so many different places that people have to go. What we are really hoping for, and what I believe in, and what made me really interested in this work, and to apply to this position, was I was really excited to see an increase in like that oversight. I mean, with now just 15 case management agencies, that oversight from the Department of Healthcare Policy and Finance, they'll just be able to work so much closer to provide more help, to provide more in-depth training, to be able to really develop, I think, great relationships with all of the new case management agencies too, coming and be able to provide a little bit more time and detail. So yeah, that is that. A total of 15 agencies from across the 20 defined service areas were chosen. And then I'll just kind of run through a little bit of that. So, and then we can also post this to the, if I could think of my words, the Autism Community Store. We always put it like in the Facebook page, and then I'll also give some links and things for members too. That's from the Department of Healthcare Policy and Financing page. But so far, so this is one half of what our new defined service areas look like. And if you're living in these different areas, in these counties, these are your new case management agency. Region 8 is Adult Care Management Inc., or ACMI. Region 20 is Community Connections, or CCI. Region 5 is Developmental Pathways. Foothills Gateway is Region 10. Garfield County, Region 15. Jefferson County, Region 7. Los Animas, Region 4. Montrose County, Region 19.
Ma'am, I
region
don't see, I'm sorry, I don't see Weld.
is, I just went down, sorry, it was on this next slide.
Oh, I apologize.
No worries, yeah. Region 1 is going to be NECALG, or Northeast Colorado Association of Local Governments. Region 3 is Otero County. Region 2 is Prowers County. Sorry, I know it's weird with the regions, but we, I think, did it in alphabetical order. And then Rocky Mountain Health Plans Organization, or RMHP, is region 13, 14, 16, 17, and 18. Rocky Mountain Human Services is region 6. The Resource Exchange, or TRE, is region 11, and pending in region 12. It's pending a protest. They received the intent to award, but it is still under protest right now. So that one is not guaranteed for 12, but it is guaranteed that they will be in region 11, El Paso, Park, and Teller. And then Weld County is region 9. And so how do we plan on doing all of these transitions, taking all of the folks from where they are now and assigning to their new case management agencies, if they have a new case management agency, because some things may not be changing. There's about half of the member population served that will get a change, and there's about half from the data that we've kind of pulled that'll be staying in the case management agency they're at. The Department of Healthcare Policy and Financing is going to be sending some letters out, letting everybody know, this is who you're with, this is who your new case management agency will be moving into the future, that you don't need to do anything. It's mostly our work on the back end of getting all of that done. So the transition phasing timeline, and I'll also make sure that I put in the chat can't think of my words, I'm so sorry. It's a memo from the Department of Healthcare Policy and Financing of kind of that it helps like paint that picture for you too, of what agency, what counties, all of that good stuff. And then there's a map that we'll get into. So, but for phase 1 transitions, this will go through August through October. So we've already started the back end of our phase 1 transitions. And then the new case management agencies that are in our first phase of transitions, they will start their new contracts in November 1st of 2023. The second group is going to be November through February, where we'll be kind of doing our back end work. And those case management agencies will start in March of 2024. Excuse me. And then phase 3 transitions for the last set of case management agencies, they will go through the back end work that the department does will be March through June of 2024. And then by July of 2024, all case management agencies will now be transitioned into the new case management system.
Nicolette, would you mind going back and just looking at a couple of questions in the chat that have caught up with you? Thank you.
Sure. Let's see. Okay. Lauren, will the yearly assessment process 100.2 be the same under person-centered? Yes, that will be the same. The only things that are kind of really being revamped with that is there's a new care and case management system that the case management agencies are going to be using. And they're all learning how to do that system now, but it's still the same 100.2 questions. The most nuances of those level of cares and things like that, the timing, the timeframes, the rules, things like that have not changed around that. It's just, it should be more of a person-centered approach, looking at the individual now, they're not just looking at their diagnosis and their disabilities and I think we're seeing that all people are incredibly different, and because somebody has a certain score, it doesn't automatically mean that they don't need or require services. So some of those things are really, there's a lot of training to make sure that everybody is looking, the case managers are really doing more of a deep dive, in-depth look as far as the needs go, and not just those numbers. And then Maureen, what is going on with the areas which had no intent to award granted? So now every single one has had an intent to award granted, all 20. The ones that did not have any before were picked up. That's probably why you see that Rocky Mountain Health Plans has like 5 of them, because they went ahead and picked those up. We still have, even with their 5, we made sure that there was a percentage. Sorry, I hope that's scraping. Is it? I have my rabbits are being pained in the background. We had to make sure that there was also no way that somebody or any case management agency would be able to monopolize. So it was still within the amount that it's not like they're serving more than, I forgot what the percentage is now. There was a certain percentage that they couldn't go over, but yes, all have been assigned, and just Region 12 is the only one that is currently pending and in protest. Region 9 is Weld County. Yes. And my daughter will move from Region 5 to 7. Does that change agencies? So yeah, it'll be based on like when, I'll show you too how to go in and look at the map. If you guys are in a certain county, that's kind of what changes that. So if you're in a particular county, then or it's moved over to another agency, or it'll just be whatever county that is in there, if that makes sense. And I'll show you the map to make sure that everybody can do that interactive. And if you are somebody who is going to be affected by change, if I was able to really finally pin down and get all the data, good, and everything goes smoothly within the next couple of days, HCPA for the Department of Healthcare Policy and Financing, they are going to be sending out letters to let you know that you're here and you're going here. And I'll get into that a little bit more too. Okay. Oh, no worries with your kid being too loud and not liking you on the phone. My bunny rabbits right now are not doing good, but at least my kid is. I have a daughter that's able to be my son's respite provider, so she's helping me with him while I do this. Yes, sorry. Okay, and will case management be based on home, permanent address, or living address, HHP? We're currently with DP Arapahoe County, but adult DD relative now placed in HHP in Weld County. So yeah, it will depend on the county that you live in. And now currently with DP Arapahoe County, but adult.
But who lives in the family or the client?
The client.
So if she's in a host home provider placement, which was made through our PASA, which is with DP, and
Sure.
it's in Fort Lupton, now we have to change everything?
No, that makes sense too. So no, I mean, since you were the, if they're using your address and you're the one that's helping to navigate those services with the case management agency, I imagine that then
we would just stay with DP.
Yes, I do.
Yes.
I
Okay.
definitely like get more clarification, but I'm pretty sure that she would, since that's where you already have those services set up and through where you're living.
Yes.
Yeah.
So we're the relative. We were family caregivers, but she's been recently placed just the beginning of September in a host home placement, but it's in Weld County. And that's what concerns me is, oh no, they didn't really say anything about, is that going to impact changing everything. So
Sure.
I'm assuming because this is a permanent home address, we're good, but I don't know where I get that clarification from.
Yeah, I would think that you could be good too. And I'm trying to think of when we're doing the update in the system, do you know whose address? Because even if you get a letter that shows I'm not sure. Some of them, that was some of the things with our letters that we're sending out is obviously some people live in different areas than mail gets sent to.
Exactly. Yes.
For things like that. But would you mind sending me an email just so I can follow up with you?
I would appreciate it.
Yeah, and I will put my email in the chat to ask that very
Okay.
question.
Thank you very much.
Yeah. And then let's see. And why not grandfather the adults in? Do you mean to stay where they are, or? I'm not sure. Because it's really just everybody is moving to a different, it's not so much like, because everybody's going to be going into one case management agency, there's not really like a grandfather system. Like some of those single entry points might not be in business anymore, or some of those community center boards would not be in business anymore. So you wouldn't, like, nothing changes still with their services. It's just they're going to move to a different case management agency, if that makes sense. Did I answer that?
Well, it makes sense for the state, but it doesn't make sense for the family, just like the other mom was saying. So I know my daughter will be moving from point A to point B, and I'm happy enough with her CCB now, and that CCB will still be one of the 15. So
Okay.
why make life harder, especially when I'm at my end of life and I'm trying to put everything in place for her sister to be able to care for her and to know the system. And I'm at a point where I don't want to know a new system. I don't want to know new people. I want to keep with what I've had for 30 plus years.
Sure. So there is also, with the letters that are coming out, there's going to be a QR code that you can scan, and an email or any other way that you need to reach out to us to let us know if you do see that your letter shows, hey, you're with this case management agency and you're going to be moving to this next case management agency. You're able to go in there and say, like, if that's a concern at all. And your new case management agency and old, they'll be sending out letters too. There is an exception process, especially for the ones who live within a close proximity to their new, and maybe you've been with this one for so long and they are staying in business. There is an exception process for you to be able to stay with them. You would just reach out to your case management agency and let them know, I don't actually want to transition to a new case management agency because I'm really happy with my case manager. And they will accommodate that. It's up to every individual case management agency to decide. The only things that we make sure that folks know is the healthcare policy and financing, they won't pay for the travel if there's like a big travel add-on. So those cases may be harder for those case management agencies. However, like you said, like if it's somebody you've already been with and you're in that close proximity, or if you have to move across the street and that like completely puts you into a new case management agency territory, those are definite exception processes that all you have to do is let that case management agency know, hey, I want to stay with you, that we're good, and most likely that's good. Maureen.
Yes. Can you hear me okay?
Yes.
Perfect. I just put in the chat a link to one of the HCPF memos about choice of case management. And I just want people on this call and maybe listening to the recording to understand that a lot of us choose outside of our case management agency, and we can continue doing that. only because we had 150 people show up at a meeting and demand it. So power of the people, yay. Point for the people. So anyway, I encourage people to look at that memo. It's memo 54, I believe, from 2023. In case you can't see the chat, I'm not sure if the recording will show the chat, but if you go to the website for HICPUF and you put in memo 23-0, I just want to double check that it is 53. 056, excuse me. So if you put in operational memo number 23-056, you can read that. And that shows all of the rights that was just written on September 6th after families rose up in demanding choice. So thank you for the webinar tonight. I just want to make sure that families know that you don't have to live across the street or be with a case management agency. This is choice because it's person-centered, and that's what the federal government wants for our families. Thank you.
Thank you, Maureen. Yes, she is correct. So if you were in a community center board, it's no different than the way it was now. I mean, it was a little different for anybody who was in a single entry point. None of them actually had the choice of case management agency. That always depended on your county and where you lived. But for the community center board and IDD population, they were always able to have a choice of being served from one to the next. The only thing that's changed a little bit now is, you're correct, it doesn't have to be in close proximity. I just want to make sure that folks know, if they're being served, or they live in Colorado Springs and they have TRE and they want to move to Weld or Underweld, Weld may decide, I don't have the funds to be able to do that travel annually for your to go and do the different things. But everyone will have their own business model. They'll kind of figure it out, and that's why all you have to do is reach out to your case management agency and let them know what your needs are, and that you want to either stay or that you would want to move to another.
Right. And looking at that memo is really helpful because some of the CCBs, especially the smaller ones, may not know the memo. I just want to make sure families know their rights. And there actually are case managers that live in Colorado Springs for some of the Metro Denver CCBs. So, and welcome to the SEP community for having choice. That's awesome that now they have choice too.
Yeah, it'll be awesome for everybody to be able to have that.
Nicolette, I know we only have about 15 minutes officially left. If you want to finish the questions first, that's great. Or if you want to do the rest of the presentation and then address the questions, that's fine. I'm happy to stay on longer as needed.
Great. Yeah, maybe I'll just get through the rest in case there's more questions, and then I don't mind staying on for some more questions either.
Okay.
So far, I don't hear any screaming or craziness happening in my background, so it looks like we're doing okay. Okay, so this one is just basically, it's another it shows what that looks like. When will my defined service area or DSA transition? So this is kind of like a couple of little maps that will go to that. And again, we can post this so that everybody can see it, to know if you're in these counties, this is when you're transitioning. So the Prowers, Otero, DP, Rocky Mountain Human Services, TRE, part of Rocky Mountain Health Plans, and Community Connections, Inc. They are all transitioning by November 1st. NECALG, Los Animas, Weld, possibly TRE 12, depending on protest. Rocky Mountain Health Plans and their DSA 18 and Montrose are transitioning by March of 2024. And then the last transitions are going to be Jefferson County, ACMI, Foothills Gateway, Garfield County, Rocky Mountain Health Maintenance Organizations are going to be transitioning in that last cohort, and all transitions then done by July 2024. So private case management agencies serving members across the state will transition. These are for anybody who's on a CHCBS waiver, and they are served by a private, one of the 4 private case management agencies that I mentioned. They serve across the state, and their transition will be in phase 3 to ensure kind of that continuity of care, because they're kind of dispersed all over. And so we wanted to make sure that nobody gets lost in the shuffle. Absolutely, that everybody's going to be transitioning to the correct place. And in some cases, some of those private case management agencies may actually be contracting with one of the other case management agencies that won the bid. So there could be some of those cases where you would still not be changing your case manager. And we are still hoping for what we're trying to do and track, which is a really important thing that a lot of folks don't know, is what we've been asking for some of those outgoing agencies to do is, obviously, we're hoping that a lot of them will, for the new case management agencies, that they will hire on those case managers that have always done those case management needs. And we're asking that they kind of send those caseloads so that where we don't have to move or change somebody's case manager, we won't. So we're really working hard to track that for any of the ones who are moving from a outgoing to an incoming, tracking that the case managers that are also going to be transitioning over to the new case management agency, that they can keep that caseload. So see for the, so this is that, let me see if I have it. No, I'll have to put it in the chat after, because I have like too many things up right now. But so there's also a new webpage and resources for members. It's the My HCBS, My Home and Community Based Service Case Management website. This has a lot more. I'm so excited about it. And we worked with a couple of different contractors in the community, and we've made a lot of new really great videos that are informational about home and community-based service case management, information in English and Spanish, and our videos that were, we partnered with CCDC. They also have theirs for American Sign Language translation. So they're really great videos. It's a really great website to be able to go to, and it will also give a lot more information about case management agencies, including the new interactive map. So in this map, you'd be able to go to, you can drop down what your county is. It'll then show you what your case management agency is. You can kind of look through it by any of these, like defined service area, case management agency, however it's easiest for you to know then what that is. And then we're populating in, if it's not already complete, their contact information and everything else. And of course, we do still have the subject to change pending any protest decision. And then lastly, I've kind of talked about this one a little bit too. It's the members, communication to members. So the Department of Healthcare Policy and Finance, we usually do, there's the Office of Community Living has monthly webinars. I'm going to take these and make sure that I put all of these in the chat as well. If you ever want to sign up for the stakeholder engagement meetings and things like that that I talk about, it's super important. It's really great for everybody to go and make sure that your voices are heard. Make sure that, you know, HICPUF just is really working to get everything right and for what your needs are. And I really encourage as many people as possible to attend those webinars. And this will give you a calendar of what's coming up and when we do kind of meetings like this where we're explaining what's going on. And then of course there's the My HCBS case management website. There's a case management redesign website that is an overall, and it has all the memos and everything that have anything to do with case management redesign, any past meetings and recordings that we've done. It also just has all of the information. It's geared more towards providers just because some of those policy memos and everything, but it's also really great for members who really like to jump in and get involved and know those policies and procedures and just all of the things. And then what we have in the works, we like to do the annual listening sessions, case management agency, communication with members. They are going to be sending out their letters to make sure that you know that you're either transitioning out or into that agency. And then the letters that I was talking about that we are going to be sending out through HICPUF, which will have a QR code linked to the form so that you can go in case you do have any concerns over maybe where you're going, what's going on, anything with your current case management agency or moving to the next. I mean, it's a linked form where you have the opportunity to go ahead and go in there and do that. And then I am going to stop sharing and I will take some questions and I'm going to get some of those links. Okay. Gabby, you have had your hand up for a little bit while I kind of race through that ending there.
Sorry.
No, you're
I just
good.
I probably forgot already my question. No, just kidding. So what's gonna happen with, I have two questions. So what's gonna happen with the waiting list, specifically the ones for DD adult waivers?
Sure, there's no changes to that. Right now, that is the only wait list that there is.
Correct.
And there's no changes to that right now.
So that will follow you to wherever you go?
Yes.
Okay. And then now that we will have a centralized system, would there be would that criteria, everybody does a different, like how do they apply fundings for family dollars and meal levy money? Is there gonna be a standardization of how agencies distribute that money?
No, there's no changes with that either. So whenever you have any of those, that is one of the only other things too. Like if you're you'll still go to your case management agency. But kind of like now, like if I'm living in wherever, like Denver, and I move to outside of Denver, I may not be able to access those mill levy funds. You have to be within the region for still some of those mill levy funds, because that's a little different. But everything else it's the same and not changing, and you would go through your case management agency.
Okay. Alrighty.
Maureen,
Thank you.
sorry, did you have another one?
No, that's it.
Okay. Maureen.
Yes, thank you.
Yeah, this is Maureen. I just wanted to follow up on, is it Gabby's question? And that is about the mill levy. The mill levy is actually a contract that the county commissioners or the county, city and county, depending on where you live, they contract with the agency. So if you have questions about that contract, the point of contact is also your county or city and county if you live in Denver, because there will be some changes there with the agencies that are in the 5 mill levy counties. Some of them do have changes of case management coming up, and it's not a given, it's not assumed, it's not automatic that the new case management agencies will get that contract that the previous CCB had. So I suggest you reach out to the county commissioners if you have questions on that. But Family Support's a state program. So again, that case management agency, Nicolette, correct me if I'm wrong, but they would have to apply for that contract with the state of Colorado to do the Family Support Services Program funding, correct?
Yes, and that's still all stuff that we're making sure on the back end is streamlined and that everybody is getting set up with. And we have like lots of checklists that our case management agencies are going through, and applications and different things like that too, to make sure that they are able to fully serve their members.
So we might end up with 15 case management agencies and 5 different agencies for family support dollars. We might.
I don't
if they don't?
anticipate that.
Okay. Thank you.
Sure. Let's see, is there anything that let me see how far I need to go back for questions. My case management won't change in Denver, but I was wondering if I'll be getting new case managers. If not, can I request a new person? You can always request a new case manager at your case management agency. That's a definite. If there's ever, you know, anything going on within your case management agency, maybe you just don't mesh well with that particular person, then you certainly can always request a new case manager. And then there's lots new really great things that I'm working on with a new community advisory committee within the case management agencies, really trying to work on them, doing a lot of outreach to members and family members, and really hoping that as many people as possible get involved in those community advisory committees. If you ever do receive outreach from your case management agency, because it's a really great opportunity for you to help them and give input on their policies, procedures, complaints, how that works, all of that good stuff. I mean, there's a lot more direction coming from HICPUF than previously was able, because again, we get to like kind of hone in on a little bit more of that. And then and I'm just really, I don't know, I'm excited for the future of case management and really excited to increase the quality there and in many different ways. And it really just starts with you guys getting involved as well. What's going to happen with and you asked that, the wait lists. And I have a case management outside of my area. The memo above shows how I can keep that in place. The memo. Oh, that was what Maureen sent over. Did it give the link?
The link is in there.
Is
I
that
can
okay?
repost it. I can repost it at the bottom of the chat.
Okay, great, awesome, thank you. And then also on those, again, those other links that I gave, that's the case, my case management, my HCBS case management, that will have that interactive map, and the other larger case management redesign will have all memos, past recordings, past meetings, stakeholder engagement. There's a huge revamping, obviously, of a lot of the rules that have to we didn't want to just change some of the case management rules to align with like some of those little changes. We did like a whole other revamp of the rules. So those are also in there. And the meetings that we've had regarding all of that, but they're just a wealth of information that's in there if you really wanted to follow.
I'm sorry, what rules are you referring to?
So the rules from the state rules and regulations for case management agencies and providers, and regarding our services, all of those types of rules, we've decided to kind of change, not so much what the actual rules are. The only major changes were obviously like there were some things that had to move, no longer like saying things like SEP or CCB, little language things, but also we wanted to make them easier for members to be able to search and find, and for our case management agencies to be able to search and find. We wanted to use more plain language throughout. There was tons of stakeholder engagement in all of those meetings to kind of call out any kind of any little mistakes, any little areas where we could change it to plain language. Lots of interaction to make them more understandable, because as we know, like if you've ever had to go through the rules, I don't know, maybe you've received one of those, I have before, you're being denied services because of this rule right here, and then it's just kind of like, open to interpretation sometimes. We really tried to tighten up a lot of those areas as well and make it easier for members and case managers to be able to really read and understand and find, if that makes sense. And then love to get the slide deck emailed to me along with the recording. Yeah, absolutely. Do we have your email in the chat?
I have everyone's email.
Do you? Oh yeah, because everybody had to register. Cool.
Rachel has a question.
Go for it.
Nice. So sorry. I just had to figure out how to unmute. All right. I have a question, and this may not even be related to this, but I recently switched CCBs because of a move. So I'm trying to kind of get in with the new CCB and also navigate these changes, plus the end of parent caregiver stuff going on. So the thing is that I needed an educational advocate, and in developmental pathways I asked for mill levy boards funds. I mean, and when I asked at Weld County for the new thing, the board that I have right now, they stated that they are a nonprofit, so they don't have mill levy funds. I don't know if that makes sense.
There are kind of like what Maureen was saying earlier, is those are a lot of times through the counties and county commissioners, and your mill levy is it doesn't always come through. Like some areas might not even really have mill levy. But if you needed to, we have lots of advocacy groups at the store too that we can go ahead and send you some information to.
Yeah, this is Maureen. Weld County did not put the mill levy on their ballot, like
Okay.
the 5 Metro Denvers, so they do not have it. They also have a conservative base, so the reason they didn't put it on the ballot is they didn't think it would pass. So
Sure.
yeah, unfortunately, but I have case management outside of my area, and my residence is still in the mill levy, so I can still access mill levy through the community center board that I do not get case management from. So just so you know, you can go back to the CCB where you live and get the mill levy, even though you have case management somewhere else, because you're still a resident there. So don't be afraid to do that if you live in a county that has it.
No, we live in Weld. We moved from Douglas.
Yeah, unfortunately, then you're out, but you could have, have your waiver. That's it. Sorry.
That's okay. Yeah, we'll figure it out somehow. And we've pretty much exhausted things because it was sort of at we're at like separate school, and we're at like, this is not working. And it's like coming to, we need to talk to lawyers if we can't figure this out.
Sure. Yeah.
So we've already been through all the nice people.
Yeah.
Now we
No,
need to hire gun.
we can absolutely get you in touch with some advocates that can
Well,
help
I've
you
been
out.
using an advocate already. It's just a matter of funding her $300 fee
Sure.
per hour. Yeah.
And you said for education, is it because of like IEP stuff, or is it just this other that you were talking about?
Yeah, no, it's IEP stuff. It's like placement stuff.
Sure.
It's school trauma stuff. It's,
Have you worked with any of the free advocacy groups?
I worked with Peak Parent, and
Uh-huh.
I worked with not developmental pathways. I did, but the ARC,
Yeah.
and they all kind of said, this is kind of beyond us.
Gotcha.
When we went to like state mediation and things like that.
Yeah.
So
It's definitely a theme in our parent support groups. And I feel you. Yeah.
Email
going.
me. I put my email in chat, and I have a lot of resources at the store. And I can kind of start helping you maybe to fill out some more resources for you on the education stuff.
okay, thank you.
Thank you, Kirsten. Yeah, we've had a lot of that as obviously schools started, and it's been rough. It's been rough for me and a lot of people. So I totally feel you there. Are there
The
any?
question about mental health waivers, someone said, does this apply to mental health waivers too?
Yes, it's all 10 waivers that are served in Colorado. They will all be served under that case management agency in that defined service area, or one of the new that were awarded the contracts.
So picking back from that question, because mental health was mentioned, and I kind of missed the beginning of your presentation where you said something about not longer using the PAD to assess the person to see if they qualified for the waiver or not. Did I catch that correctly?
No, all of that is the same. That's going to be the same under, like, for those, it's the ULTC 100. It's all under a new kind of care and case management, like EHR system, electronic health system for the case management agencies. But that is not changing. And how the other stuff is changing for, I'm not on the team that is doing any of the the nursing, any of that stuff. I don't have any updates. I don't know anything about. I'm more just in the weeds with the case management redesign now, and kind of waiting like other folks too on some of those. I'm like a parent CNA, and we're still paused, and I know that there's things like that going on, but I'm not as in the weeds with those things.
Nicolette, did you say you could put your email in the chat?
Yeah.
If you could do that. I didn't know which one to put in there, so I didn't want to do it wrong.
Oh, sure.
Thanks.
I'll do this one just in case, my personal, and then if I need to reach out through work, I can do that. But yeah, definitely for the ones like to nail down some of those, like if you have somebody that's in a group home and the address is there, which address and whatnot. That's a great question. But again, like we kind of talked about, you have your address there, if it makes more sense for you not to have to change and obviously uproot anybody. I would just reach out to that case management agency and say, hey, we still want to stay with you because this is where we're thriving. Jamie.
Yes, I kind of wanted to, I guess, piggyback on Gabby's question. I understand there isn't going to be a new assessment tool, but you had kind of mentioned that the case management agencies and case managers are being encouraged to look closer at the person and their needs versus the score. So what incentive do they have to do that? Because if the criteria is not changing, or there isn't a new assessment tool, is there new language, or is there an incentive for them to look closer? Because I know there's plenty of people with disabilities out there that really do need more than what they're able to get, but they don't qualify for a waiver because they don't meet that specific criteria that will qualify them.
Sure. It's not so much a change in like criteria or incentive even. It's more training that needs to happen more. And because, not all of those, like, I mean, I know that it seems cut and dry in those, but I think more of the training is around looking at, obviously, like this score may be, what is it, 70 or something, 70 or higher, they don't qualify. But with being able to train that case manager to know and understand, hey, you can also go through and do some other, like, let's look at the adaptive skills, and what's that score with it too, because if that's obviously significantly lower and the IQ is at this point, it's just tough because there isn't like a one size fits all. And I think that's what we are really working hard on, is making sure that we are providing enough of that training so that the case management agencies know, oh yeah, well, that makes sense. Like, obviously we're just looking at the score, but like one of the case manager supervisors through the Department of Healthcare Policy and Financing, I've been able to hear her even on some of the meetings, you know, explaining those kinds of things, like letting people know that not everything is cut and dry, and just being able to provide more of that one-on-one support that we can give them, and that we can give the managerial staff, and so that can trickle down as well. I think that's where we really have to start, is to show that, you know, start looking holistically at people, start looking at them as a whole and not just those diagnoses and whatnot. And then the only other, like, I guess if you could say incentive, like through these new contracts, there's larger rates now too for what these case management agencies are going to be receiving because of all of the nuance and work and everything that they are going to be going under. So definitely there's a little bit of a pay incentive for that time through their case management that they're doing.
Thank you.
Yeah.
So one more question popped up in the chat. Does this have any effect how people who need services initially apply for waivers?
You mean if you're needing to apply right now, or just at all? Because there's no change for any of the eligibility or how to apply. You just always go to your case management agency and let them know what your needs are and apply through them. So all of that process is the same. And then if it's like, who do you go to apply right now? I would say just go to whoever your current case management agency is, and depending on what transition phase or where they need to go, they'll be able to navigate you in the right place, because obviously we can't hold on any of those things until all of this is done and over. I mean, our lives are happening now, so they'd make sure that they get you to the right place to start the application and eligibility and all of that good stuff.
I think that's everything on the chat, and a number of people have left. So I think we'll wrap it up unless there's any more burning questions. Go ahead and unmute and shout it out. Otherwise, we'll send everybody a copy of this and the links. And thanks to our speaker tonight, Nicolette. Wow, you were really good at answering a lot of tough questions. Thank you so much for your time and your effort and your genuine caring as you live this process. Thank you. We appreciate you so much.
Thank you, Kirsten.
Mm-hmm.
Thank you, everybody, for coming.
Yes,
And
thank you all for coming. And we're always happy at the Autism Community Store to
Thank you.
try to point folks in the right direction.
Yeah. All right. Take care,
Bye.
everyone.
Bye. Thank you.